Good morning, and thank you for being here. We are joined again, as usual, by Dr. Joe Cantor. He will speak and take questions in a moment. 1 week ago, when we had our press conference on last Thursday, I announced a new all-time record of daily COVID cases. At that time, it was just over 14,000 cases in a 24-hour period. Yesterday, we broke that record again, and it wasn't even close, 17,592 new cases. For comparison, our single-day record during the Delta surge was 7,548 cases that were reported on August the 13th. So we've more than doubled that at this point in this Omicron surge, which reflects what we've known for a long time now, that this variant is much more transmissible, and it is infecting more people on average than any of the prior strains of the virus that we have encountered. There's also a growing number of people who've contracted COVID more than once, and this is something that is now being reported on the dashboard. We're trying to be as up-to-date and as transparent as we can be. So we have the COVID dashboard, and they're not yet included in our overall COVID case counts, but they will be starting next week. Yesterday, we reported 2,384 new reinfections and 35,819 total reinfections since the start of the pandemic. The Department of Health is analyzing this data, is going to be able to share what the vaccination status breakdown is of this group in the future. The best information we have right now, at least that information coming out of Washington, is that 60% of reinfections between September and December were among the unvaccinated. And so this sort of proves what we've known for a while. You can't rely on the natural immunity conferred by a previous bout with COVID-19 in order to continue to protect you over time, especially now that we are a year removed from the height of the Alpha and months removed from the height of the Delta surges. If you've had COVID in 2020, for example, and you decided that you were going to rely on the natural immunity conferred by that experience with the disease and not to be vaccinated, you're quite frankly not protected. And we know that natural immunity wanes over time. And we've also been saying that vaccinations wane over time too. But that's why you get fully vaccinated and then you get boosted when you can. And what we know is very promising about the protection conferred about vaccines, especially if you are boosted, because if you're vaccinated and boosted, you're 10 times less likely to contract COVID in the first place. You're 17 times less likely to end up in the hospital, and you're 20 times less likely to die. So when you look at the protection afforded by natural immunity and that afforded by vaccination, hands down, vaccinations with being boosted is going to protect you much, much more. And obviously, when it protects you, it protects your family and your community, your coworkers, and everyone else. So we want to make sure the public is getting as accurate a picture as possible of what this surge and our COVID situation looks like today. And without including the enormous number of recent reinfections, I think we're missing a big part of that picture. Dr. Cantor is going to share more about that in just a moment. I also want to talk about hospitalizations and the notion that Omicron is not dangerous enough to be concerned about. That is clearly false. And as we said last week, is Omicron less violent? Yes, thankfully so. But there are many, many people who are severely sick, and we have an awful lot of people in the hospital, and a number of young people. We're going to get to that. So with 2,081 people hospitalized with COVID today, we have eclipsed our January 2021 height, that we had 2,069 a year ago hospitalized. That was the most we had on a single day back during that particular surge. Last week, we talked about the early evidence showing that Omicron on average tends to be less severe. But you can draw the wrong lessons from that, because that's clearly not the case across the board. Far from it. And you know, so there are some people, and you hear this, you know, from folks and on social media and otherwise. Well, since this is a little less severe, let's go ahead and catch it. Well, I will tell you that is not a good strategy. You don't want to get COVID, period. Because even the cases that are referred to as mild will make you feel sick, and very sick in some cases. It means that you can probably manage your symptoms at home if you have a mild case. But we've seen many cases where symptoms have persisted for a very long time. And it isn't like if you choose to expose yourself and contract COVID, you can also decide which or how severe your case of COVID is going to be. I mean, you just can't do that. You do get to choose, however, whether you have the best possible protection against being hospitalized and dying. And for the reasons that I mentioned earlier, that does mean being vaccinated and being boosted. And we know that the more people who end up in the hospital, the tougher things are going to be for our state, for the hospitals that are trying to deliver care, for anyone who needs care, not just the COVID patients, but for whatever reason, somebody might need to go to the hospital and receive life-saving care. You know, it's not like that when you have a pandemic with COVID, you don't have other things happening. For example, the flu, or perhaps automobile accidents, strokes, heart attacks, you name it. Those things still happen. And I want to go back and talk about this too, this idea that some people think, well, let's just go ahead and get it over with. You remember we used to talk in terms of flattening the curve. And that's so that too many people don't end up with the disease all at once, because that's what presents so much pressure on the healthcare delivery system that it just can't manage. And so you have to extend the time horizon over which people will be positive for the disease, but also you want that number to be as low as possible, because that's how you protect the capacity in your hospital system. And so it's very irresponsible and dangerous for an individual, based on what might happen to that individual should they contract COVID, but collectively speaking, you know, it's a very dangerous situation for the state too if that happens. And we know that Omicron is much more transmissible, so we are seeing record numbers of cases anyway. And it is putting a real strain on our healthcare delivery system. So just wanted to make sure that we are addressing that. The CDC is also reporting a record number of children hospitalized across the nation right now with COVID. And we're certainly seeing that increase in COVID hospitalizations among children in Louisiana. And, you know, that includes 0 to 4-year-olds as well. People who are too young to even be eligible for a vaccine. Last week, looking at the latest week of complete data, in the week of January the 2nd, 92 children were admitted to the hospital with COVID in our state. That's higher than we saw during the Delta surge. Now, during the Delta surge, we had, on August the 18th, I think it was, the most people hospitalized at any time. And on August 18th, that number was 3,022. But we have more children hospitalized today than we did at the height of the Delta peak. And so people who think that this is harmless for children, it's clearly not. And I know that you know, here we are just a couple of months away from the second anniversary of this pandemic. And after the 22 months or whatever it's been, people are tired. And I get that. Quite frankly, I am too. But that doesn't mean the pandemic is going to go away because we're tired of it. We still have to do those things that are necessary to protect ourselves and our families. And we have tools today that we didn't have back then. And I know everybody wants to enjoy Carnival and Mardi Gras, but what we do is going to determine how pronounced this surge is, how long it lasts, and so forth. So I'm encouraging everyone to do the single most important thing you can do if you haven't yet, and that's get vaccinated. If you have been vaccinated and you're eligible for a booster and you haven't yet been boosted, please get that additional shot. Wear your mask indoors and outdoors if you're going to be in among people and that distancing is not going to be possible. We're encouraging people to work remotely if possible and limit exposure to people outside of your everyday household. And again, this is not forever. At some point, we will peak out in this surge as we have previously, and we're going to start coming down the other side. But quite frankly, we're not there yet, as evidenced by the fact that just yesterday we announced a record number of COVID cases for a 24-hour period. I do have hope, however, about the vaccinations, because every day there are people who are changing their minds and they are rolling up their sleeves. They're getting their first shot. People are getting boosted. And quite frankly, it's not in the numbers that we would like, but the numbers are considerable. And I don't know what causes people to change their mind. It could be that they lost someone to COVID, or they've seen someone who was close to them have a very severe case. Maybe they know that their kids are going back to school and they want to protect their kids, and they want to be protected from kids who maybe not eligible for vaccines. But whatever it is the right thing to do, and I would just encourage people to do it. I think at this point, I've covered what I wanted to cover at the outset. I'm going to ask Dr. Kenner to come up. He's got some slides he's going to go over. As usual, please ask him questions if you have any for him while he's at the podium, and then at the end of that, I'll come back up and take some questions as well.
Good afternoon. On behalf of Secretary Phillips and LDH, I'd like to thank the governor again for your leadership throughout this crisis, and welcome everyone this morning. As the governor said, the experience this past week has been yet another week of truly explosive case growth, both across Louisiana and the country, in numbers that we just, quite frankly, have never seen before throughout the 21-22 month course of this pandemic. The growth has been so explosive that if you look on graphs nationwide of case counts, they've had to change the y-axis because the rate of growth has been just so extreme over the past couple of weeks. And this past week really, unfortunately, has been no different for Louisiana. As the governor mentioned, yesterday we had a new record of new cases in a day, over 17,000 new cases in a day, and that's following 2 days last week when we set records as well, without any real tangible sign that's slowing down yet, unfortunately, although I'm hopeful that we'll see that hopefully soon. If you look at the incidence on the graph here, this is the number of new cases diagnosed day in on day, you'll see that explosive growth that I refer to on a magnitude more than each of our 4 prior surges, and without yet peaking, which is the ultimate concern here. We are at right now an average of 1,720 new cases per 100,000 residents per week, 1,720. And again, to put this in context, and I said this last week as well, what the CDC considers to be sufficient to place your locality in the highest of 4 risk categories for community transmission is to be above 100 cases per 100,000 per week. 2 weeks ago, we're at 287. Last week, we're just above 1,000, and this week we're at 1,700. Really remarkable spread of this virus. And again, yesterday was the single largest new case count that we've had throughout this pandemic. Omicron remains the culprit here, and Omicron is accounting for somewhere between 95 and 100% of each new case of COVID contracted in the state of Louisiana. That's the same for our region of the country, and nationally the number is about 95. So we're still very much in this Omicron surge. If someone were to get exposed or contract COVID later today, odds are far more than likely it would be the Omicron variant. Next slide, please. We'll go through the usual data points that we look at, starting with COVID-like illness, which is the patients that come into an emergency department across the state with symptoms suggestive, symptoms that could be COVID. That's the top left graph here. We do see a little bit of a decrease. Last week, we peaked out at 16.7% of all ED visits attributable to COVID-like illness, and we've gone down to 12.5%. I'll tell you, it's a little bit difficult to know what to make of this. On one hand, perhaps it's signaling that our peak might be near. On the other hand, EDs have been so very busy, and we've been messaging, as of a lot of hospitals, to avoid the ED, avoid the emergency department unless you really need it. And the waiting rooms are big, so some people check in and then leave without ever being seen because there's so many people in there. That might have an effect and drive that number down too. Which of those two it is, I really don't know, to be honest. On the top right, you'll see that incidence graph that we just looked at a slide ago, explosive growth, not yet really peaking at all. On the bottom left, you'll see the combination graph. The purple line on the top is testing volume. We are testing more individuals for COVID in Louisiana than we have ever tested at any point prior in this pandemic. You can see that line is as high as it's ever been. This past week, we tested 523 people per 10,000 per week. That's the highest number that we've ever been. We've tested over 600,000 people in January alone, and we're not even halfway through January. So we're doing considerably more testing than we ever have before. I think people surely feel, people that are looking for rapid tests and they're having a difficult time finding them sometimes, that there's still not enough, and I think that's right. But the volume of testing is considerably more than we have ever done at any point prior in this pandemic. Percent positivity, which is the bottom part of that same graph, unfortunately continues to rise. Last week it was 27.1% of all tests coming back positive. It's up to 28.6% right now. That's the highest that we've ever been, exclusive of our initial March 2020 surge, when percent positivity was artificially inflated because testing volume was so low. So practically, it's the highest point that it's really been. I'll tell you, it might be tempting to say, on one hand, we have so many cases right now because we're doing so much testing, but when you have a percent positivity as high as 28.6%, you're still undercounting a lot of testing. That's a signal that there's still more COVID out there than is being tested. So a remarkable degree of spread. There is more COVID out in Louisiana than at any point prior, and I know we said the same thing last week, but there's even more out in Louisiana right now. Then on the bottom right is hospitalizations, which we pay very, very close attention to. We are going to surpass the 2,000 mark today. There's 2,081 individuals hospitalized or COVID positive in hospital beds throughout the state. 129 of them are on mechanical ventilators. That's a ventilation rate of 6.2%. A little bit higher than what it was last week. We were somewhere between 4 and 5% for the past 2 or 3 weeks, but still considerably lower than earlier surges. In earlier surges, we had somewhere around 15 to 20% of hospitalized patients on ventilators. That was a mark of the acuity, a mark of how sick on average people were getting with COVID. Clearly, the acuity on average with Omicron is less, and there's less people, relatively speaking, in the hospital who are on ventilators compared to everyone else who's in the hospital. That's good news. That is good news, because quite frankly, if we had the same level of acuity, if Omicron was making people as sick as the prior strands were, as Delta did, the hospitals would not have any chance of withstanding that right now. So that is good news. As the governor said, though, that's just an average. That's just an average. You still are possible to get very sick from Omicron. We still are putting patients on ventilators and in the ICU. We will be reporting out 11 new deaths, unfortunately, today. You still can get sick. So we're thankful the average is that less people are getting sick with Omicron, relatively speaking. But number one, it's just an average. It doesn't guarantee that you won't get that sick. That chance is still there. And number two, with that many more people getting infected in the first place, the numbers still add up, and they still create a very large burden for hospitals. It remains true that 3 out of every 4 patients hospitalized with COVID hospitalized with COVID right now across Louisiana, 3 out of every 4 are unvaccinated. The next slide, please. I want to break this down a little bit by age groups, and we see an interesting trend that we have seen in prior surges. Last week, it was clear that the 18 through 29-year-old age group was leading the pack in terms of getting COVID during this surge. They've now come down just a little bit, as have 30 to 39-year-olds. But if you look at that graph, the below 18-year-old line has completely shot up. This is consistent with what we've seen in a couple other surges where 18 through 29-year-olds really are ahead of the pack and start with the bulk of the transmission, but it doesn't stay limited to that age group, and it very quickly spreads to both younger and older individuals. I do hope it might be foreshadowing a peak soon. I can't say when that would be, but this is a trend that we have seen in a few surges in the past. I also want to take this opportunity just to give my most sincere respect and appreciation to teachers and educators and school administrators right now. It's been so challenging to keep schools operating right now through this surge. You can see in that graph the below 18-year-old line so high, and folks that are teaching our kids and helping operate schools are working so hard to make that possible. So all the appreciation in the world to folks who are working in the educational world right now. It's been challenging, but because of their efforts, we've been able to maintain as much in-person education as possible. Next slide, please. The governor had mentioned that we'll be doing some more tracking and displaying of our reinfections. And this is important because, to date, we've been internally tracking people that got reinfected, and we're considering someone reinfected if they test positive 90 days or more after their initial test. That's what we consider to be a reinfection. We've been tracking it internally, but we've not been putting it out, on the dashboard or in a more formal sense. We are now. So you can go on the dashboard now and you'll see that today there's about 2,000 new reinfections, and all told throughout the pandemic, there's been 35,819 reinfections. These are people that had COVID, tested positive, and then had it again, tested positive again at least 90 days after that. At this point in time, those reinfections are not being added to the total case count, but I do want to let you know that at some point next week, we will start folding those numbers into the new case count. So at some point next week, the new daily cases and the new total cases will be reflective of reinfections as well. They have not been reflective of those numbers to this point in time. Next slide, please. The degree of reinfections has really changed with this Omicron surge, and this is an incredibly stark graph if you can see it. This is the number of new reinfections that we have reported to us day on day. And as you can see, the number's been modest up until this Omicron surge where it's completely skyrocketed. This illustrates the importance of getting boosted. Fully vaccinated plus boosted is really essential to have adequate protection against Omicron. Omicron has enough mutations, over 50 mutations on the virus, a number on the spike protein, that having 2 doses of an mRNA vaccine is not insignificant. It does add protection against severe disease, but you get significantly more protection when you get boosted. And that's what this graph essentially shows. Without the booster, there's a lot of people that are going to remain vulnerable to reinfection throughout the Omicron surge, which again, we're still very much in and has not peaked yet. Next slide, please. Talk a little bit more about booster guidance, and the CDC and the FDA made a little bit more news over the past week on this. So it's relatively consistent now. And I'll walk through who is eligible and recommended to get a booster shot. If you had Pfizer or Moderna, you are eligible and recommended to get boosted once you've hit the 5-month mark after finishing your initial series. So 5 months after you had that initial second dose, you're eligible and recommended to get boosted. For Pfizer, this goes down to 12 years of age and older. For Moderna, it's 18 years of age and older. 5 months for one of the mRNA vaccines, and you're recommended to get boosted. If you had Johnson & Johnson, it's 2 months after that. Again, I cannot recommend in strong enough terms right now how important it is to get boosted, particularly now, because it significantly increases one's defenses against Omicron. It's very important to get boosted right now, and the number of reinfections that we see with the Omicron surge is further evidence of that. In the next slide, please. I do want to take a second and talk about contact tracing. A couple of changes with these Omicron surge. Number one, the incubation period with Omicron is a little bit shorter, which means there's less time elapsed from the time someone gets exposed until the time that someone starts developing symptoms and is likely infectious. And number two, there's obviously been an explosive increase of cases. So the window for which contact tracers can reach someone and provide the intervention is narrower with Omicron for that reason. And also, I'll add, there's a lot of people now that are getting their positive test, not by a doctor's office or a testing site, but at an at-home test. And those cases typically don't enter into our case counts. They typically don't enter into our contact tracing workflow. So for that reason, I really want to urge people, if you are positive and you have any questions at all about how to isolate, what isolation means, what other precautions you should be taking, don't wait around for someone to call you. Proactively call in and ask those questions of the contact tracing team. The number is up on the screen, and I'll read it off. It's 877-766-2130. For most people now, the answer will be, if you're positive, isolate at home for at least 5 days, and at day 6, if your symptoms have improved, if you're no longer with a fever, you can go back to where you were before if you wear a mask consistently for the remainder of those additional 5 days. For most people, that's the guidance, but again, if anyone is positive and they have any questions at all about what they should be doing, what they should be telling friends and family, don't wait for someone to call you. Go ahead and call that number and get those questions answered. I'll take a step back right now, and throughout this Omicron surge, there's been about 200,000 Louisianans who have been infected with COVID, and those are just the ones that we know about. We don't know about people that test positive on a home test, and we obviously don't know about people that have symptoms, presume they're positive, and don't test at all. So we generally believe that number to be undercounting by a factor of somewhere between 3 to maybe even 5 times. Point being, a lot of people have been infected with COVID during this Omicron surge, and there's absolutely no shame in that, because this variant of the virus is so incredibly transmissible. On the other hand, if you have not been infected with Omicron, with COVID, during this past surge, if you have any choice in the matter, you'd like to keep it that way. So I'll make the same ask that the governor did, which is for the next few weeks, next couple weeks, please take precautions. Again, this is not forever, but we're in this incredible surge now. We've not peaked yet, but we're hopeful we will soon. If you've not yet had COVID this surge, please take precautions. That means wearing a mask, particularly when you go out in crowded settings. Take precautions, particularly in gatherings outside of your family. It's not forever. We do think we'll be making progress on this surge soon. And if you haven't had COVID, you really want to do everything you can not to. I share the governor's view that 2022 will be a much better year for us, but we do have this hurdle to get over right now. And that means we need to take precautions as much as we can. Thank you. I'd be happy to take any questions if there are any. Yes, ma'am.
Andrew, some people are nervous to leave their quarantine after the 5 days after testing positive. Some people are trying to get another test after day 5 or 6, but they're still testing positive. If they are still positive after 5 days, should they stay in quarantine?
Yeah, I think they should. The question is, what would you advise someone who's in quarantine because, well, you said tested positive. I think you probably meant isolation. They're in isolation because they were positive, and it's at day 5, and they do take a test, and it's positive. If it is positive, and that's going to be a small subset of people, it's not going to be the majority, but it is going to be a small subset, and the CDC kind of laid out the data on that. If you are still positive, I would advise staying in isolation, for another day or two. What the CDC did is they said, they kind of made a judgment call and made a recommendation they thought would make sense for everyone. But they did say 2 things to give caveats on that. Number 1, when you do come back at 5 days, to strictly mask, to protect against the scenario you're talking about. And they also said, if you anticipate being in a high-risk setting, if you're going to go visit frail relatives, perhaps wait more days. So I think that's really good advice. Yeah.
So the number of nursing home residents who are boosted seems a lot lower than last year when nursing home residents were being vaccinated. They seem to be like ahead of the trend, or more of them were vaccinated because there was that big push. Can you explain what the difference is and what's being done to try to get booster shots to nursing home residents?
Yeah, there's right now there's somewhere between 50 and 60% of nursing home residents are boosted. That's last week's numbers. We can follow up with you with the more up-to-date number after that. And I agree. I share your concern on this, and we advocate very strongly for anyone right now to get boosted if they're eligible, but particularly for nursing home residents because the spread can be so virulent inside that facility. I think nursing homes are working really hard to do that. I think it's been a little bit of a slower process than we would hope it would. Same thing for the general population as well. The manner in which nursing homes are getting vaccines is a little bit different than what it was at the very early stages of the vaccine campaign. And earlier on, there were these teams from Walgreens and CVS that would go out. Now nursing homes are getting vaccines through a couple of possible ways. Some are receiving vaccines directly and administering it themselves, as they do for other vaccines, as they do for flu vaccine, for example. Some are partnering with an independent pharmacy to provide that service. But every nursing home has a way that they're getting vaccines, and I full-heartedly agree with you. It's important now for nursing home residents to get boosted because the spread doesn't exclude nursing homes, and we are seeing a lot of cases, particularly amongst nursing home staff right now, that we worry would spread over. Hey, Blake?
I think I missed this. There was a slight drop in the infections for 18 to 29. Is that what you were saying?
Rate. A drop in, there's still at extremely high numbers, the rate of increase is a little bit less this week than it was last week. And the point that I made is if you look back at prior surges, it's actually a pattern that we've seen where the rate of increase is the highest initially for 18 through 29-year-olds ahead of the other age groups. And then at some point in your surge, that kind of bleeds over to the other age groups.
You talked about, and you mentioned this last week, but again, any of these models suggesting a peak anytime soon?
I wish I had a better answer for you, Blake. We've not yet seen a model that really provides confidence. It was the same thing through the Delta surge where it was so challenging to model, and this is too. The numbers we're seeing now are in a different league from anything that we've seen before, and so we just don't have any confidence in any model, at least no model that I've seen. I'll tell you, if you look at those age breakdowns, this pattern where 18 through 29-year-old starts out ahead and then gets overtaken by the below 18, that is a pattern that we have seen in prior surges a little bit before the peak. So I'm hopeful that we have the peak coming up very soon, but beyond that, it's very challenging to model or predict. Yeah. And last question.
Bouncing off of that, when we have this, in your words, explosion of growth in cases, does that maybe bring about that peak a little sooner? There's this notion that eventually it's going to run out of people to infect. I don't know how scientific that is, but when we see this amount of cases coming, does that mean that peak is going to come sooner?
Yeah, no, it's about as scientific as some of the other modeling attempts that we've gotten at. You're right, I think, and that's been the experience in South Africa, where it was fast on, fast off, and it looks to be the experience in UK and some of the northeastern states in the US. If you squint, you can convince yourself they're beginning to come down on the other side right now. This has been a faster upswing, considering the number of cases we're at, than we've had before. The hope and expectation is that it'll be a faster downswing as well. Again, we've not peaked yet, and you really never know you've peaked until you're on the other side and can say that in retrospect. But I share that hope that this surge will be fast on and fast off. Yeah. Great. Well, thank you.
Thank you, Dr. Kenner, and I want to again thank Dr. Kenner for his work at the Department of Health, and really all the people at the Office of Public Health and LDH for the work that they're doing with all of our private sector partners and others who are still engaged every single day in our efforts to really manage as best you can manage a pandemic, which is not easy. And I also want to thank the teachers that he mentioned, all the healthcare heroes out there, and our National Guard. You know, I'm reading about states that are now, because of Omicron, engaging their National Guard in various efforts. We've never stopped here in Louisiana. And the impact on our hospitals would be so much more if they weren't doing the testing and the vaccinations that they're doing every single day. And distribution missions and so many things that the National Guard's doing. So I want to thank all of our National Guard soldiers and airmen for the work that they are doing as well. You all are probably aware that the current proclamation of a public health emergency here in Louisiana expires on January the 19th. You can clearly anticipate that I will continue to issue a proclamation. We'll do it on or before the 19th to continue the public health emergency, obviously with the situation that we have. At this point, I don't expect any changes with respect to mitigation measures and so forth, but that's certainly possible. We're watching more than anything else hospitalizations, and that along with other things, but principally hospitalizations will inform our decisions going forward, and obviously I look forward to recommendations that come from our team at the Department of Health, and also looking at recommendations that come from CDC. We will likely have another press conference, media briefing next Thursday, and I do have my radio program on next Wednesday, and I anticipate that COVID will be discussed at that time as well. So with that, I will take a few questions if you have them. Yes?
Have hospital leaders asked you to reinstate a mask mandate?
No. I believe I have another call with all the hospital medical directors next week. We do those periodically. Now that's with me. The team at the Department of Health talks to them just about daily. And I will have another call with all of the Tier 1 hospitals from all 9 regions next week to see how they are doing in terms of their capacity, which it really is a function of a number of things, right? It's not just the number of COVID patients, it's the number of total patients that they have, but also the number of staff who might be out at any given time. And if you have a record number of cases, then you can assume that there's a fair number of doctors, nurses, respiratory therapists who are also at home because they have Omicron. Now, the good news there is the vast majority of those people are vaccinated and boosted, and then they'll be able to come back either at the conclusion of the 5 days or shortly thereafter. But I'll have another call next week. I have not received a request from them in that regard. Yes?
There's been a push to add a second majority-minority district to Bessie, I guess I won't call it Bessie board.
I think it would be a third. There are two.
third.
There are
I'm
two of
sorry.
8 now. So you have 11 11 members. 3 are appointed. Eight represent districts. Of the 8, there are 2 minority seats, and I know that there will be an attempt to create a third, and of course, if it can be done and the map can be drawn in a way that is reasonable and so forth, then I certainly would be interested in doing that. Yes.
I want to circle back on something you mentioned back in August before Hurricane Ida, which was with regard to state workers and either a vaccination requirement or weekly testing regimen. Is that, do you see that coming back up in the future, or is that no longer?
No, I don't, and we look at that, and quite frankly, a big part of this has to do with availability of tests, and if you just see the situation today, we don't have less tests available today than we had previously. The demand is so much higher that quite frankly, I don't know how you would do it, but what we are continuing to do unequivocally, and we do it every single day, and whether you're a state employee or not, we're encouraging people to get vaccinated. And if you are vaccinated, get boosted as soon as you're eligible to get boosted, and that will not change. Yes.
About a different crisis, which is housing crisis in down the bayou in areas affected by Hurricane Ida. Do you think going forward that the state will play a role in providing housing after immediate housing after natural disasters? Is this something that you think will be continued going into the future after this Hurricane Ida sheltering program?
Well, yeah, I mean, look, the biggest single need after a very destructive hurricane is housing. There's no doubt. You've got an awful lot of people out there whose homes were severely damaged or destroyed. You can't live in them. These people are, a fair percentage of them are low to moderate income, and they don't have insurance. And so that's critically important. And there will always be a role for the state to play. And in fact, right now, with respect to Ida survivors, we're playing a role that has never happened before. And that is FEMA's allowing the state to run a non-congregant sheltering program with these travel trailers. That's never happened before. And I'm very thankful that they're allowing us to do that because the housing program being directly run by FEMA, it's called direct housing, they have a very small fraction of the travel trailers actually delivered and in place that the state program does. And so I think that that's really important. And then beyond that, on the permanent housing piece, it will always be the state that takes the lead there. Now, you do it with funding that comes from Congress through HUD, principally Community Development Block Grant Disaster Recovery funding for permanent housing. And yeah, we are going to run a housing program, but not just for Ida. I think what you're going to see in a few days, at least we should see in a few days, is a Federal Register notice published by HUD for the $594 million that they've already allocated to Louisiana for the 2020 storms. So those are Laura and Delta, and that's Southwest Louisiana. We know that there's additional appropriations and allocations coming for Ida survivors, and by the way, we need an additional allocation for Southwest Louisiana too, and we continue to make that case. But you're going to see the state running those programs, and so yeah, there's always going to be a role for the state to play. And I don't know whether your question envisions a role beyond what I just mentioned, but we are robustly engaged and will be going forward for a long time. Look, thank you very much. As I mentioned, we will have another press event like this in all likelihood next Thursday, a week from today. Between now and then, just want to remind people, and shouldn't need to say it again, we're setting all-time records right now on a near daily basis with respect to cases. Our percent positivity is the highest it has ever been. The number of tests we're administering is the highest it's ever been. And so what that means is there is an awful lot of COVID out there all across the state of Louisiana in every single community. The disease burden is higher than it's ever been. And quite frankly, our hospitals are filling up. Too many staff members are not available for the hospitals. And so I'm asking everybody to do what you can to protect yourself. And by masking when you're indoors with people who are not in your immediate household, masking when you're outdoors if you're going to be in close proximity to other folks as well. And you cannot distance. And then make sure that you stay home when you're sick. Some people are not testing either because they just don't want to for some reason or they don't have access to them. But if you have symptoms today with the amount of COVID that we have, you should assume that you have COVID. And chances are you do. So please stay home. We've got to do what we can right now to blunt this surge so that we don't go back to that all-time record of more than 3,000 in the hospital. And you know, for those people who think, well, this Omicron surge is not as serious because not the same percentage of people are getting severely ill, we have more children in the hospital today than we've had at any point because of COVID. And so let's do what we can, but there's not a single more important thing that people can do for themselves, their families, their communities than being vaccinated and being boosted. So let's do that. I'm optimistic we're going to get through this. I am looking at all the data every single day to try to see that sign that we are at the peak. And quite frankly, you don't really know until you get there and you start seeing the the reduced numbers coming down the backside, right? So until we see that, and that has to happen consistently over a number of days before you can have any confidence about it. And so we're hopeful, we're prayerful that that happens very, very soon. But what we know is that just yesterday we had more than 17,000 people who were positive. That is a daily record. And the last record was in the 14,000 range. So we have a ways to go. And let's be patient with it and do what we can. So thank you all. We'll see you again next week.